I was setting up for a concert. We were moving some barricades and I lifted not the way you're supposed to. It caused an injury that was pretty bad for the time, but then it healed. But ever since then, I would have like flare-ups of that region that would just come and then go away after like a week or two. But it wasn't until considerably later that then another flare-up around my tailbone region didn't go away after a few weeks, started to move up my back and into my shoulders and into my knees and so on and so forth. It kept on moving around. Eventually it settled in my feet and it was very hard for me to move at a lot of points. Sometimes I would be having to use like a cane even to get around. And the only thing I could wear was my hiking boots that would keep my ankles stable. Otherwise, I couldn't really walk. None of my doctors knew what was happening. They ran a bunch of blood tests and none of them came up with anything that was of diagnostic significance beyond I had high inflammation factors. One of my coworkers, she used to be a practicing rheumatologist. She just checked me out in general and looked over my test results, and she felt fairly confident that what I had was psoriatic arthritis. And it turned out that then when I saw another rheumatologist, they confirmed her suspicions, and then I got formally diagnosed. Unfortunately, the way that the system works for the most part is that insurances typically don't want to pay for the more expensive but more effective treatments. So they force you to go onto the inexpensive treatments that have more side effects, such as methotrexate, which is a chemotherapy drug. And so I did have to start with that before I was able to move on to any sort of other medications. And that did not go over well for me. It definitely made me feel very nauseous and dizzy. It was definitely very frustrating because I knew that this disease is a progressive disease, right? It creates damage in your joints cumulatively, and unfortunately there is no medication that actually heals the damage. It only prevents further damage. So I wanted to get on the most effective medication right away, rather than have to worry about going through a medication that was not as effective, as well as also having negative side effects. Putting the interests of the profit of the company over that of the needs of the patient by putting patients on less effective medication first, especially in diseases like my own, which are progressive, it does a massive disservice to the patients, as well as to ultimately the medical system as a whole, from the standpoint of it costs more money to keep people healthy if you don't do the work in advance. My experience is one of many that is exemplary of how our for-profit medical system fails patients and how it's also completely contingent upon what insurance you have and what is covered and what is not. I almost was non-medically switched. I was told at one point by my rheumatologist that they were told by my insurance that my current medication was no longer going to be covered next year, and so we had to start picking a new medication for me. It was very stressful during that period of time where I thought I was going to have to switch off my medication, not know if the next medication I was going to take was even going to work or not. Having an advocate on your behalf for people who don't know how to navigate the system, who don't know the underlying biology, is incredibly important, because those sorts of complex interworkings of the system and biology are intentionally obfuscated oftentimes from the patient in order to keep them on ineffective medications that is more profitable for the company or more profitable for the insurance companies. I would say these advocacy groups are necessary because of the inadequacies of the current system. So they do great work in situations like these because the current system does not provide what it should from the outset. Alone, we're nihilistic. Together, we're empowered.